Hello, friends. Welcome back to Energy and Health. Today, we'll discuss a very important question: how to tell the difference between heart pain and pain caused by a spinal hernia. Many people feel pain in the chest and start to wonder, is it my heart or is it my spine? The sensations can be confusing, and sometimes this mistake can be life-threatening.
Why it matters. Heart pain is serious. It can be fatal if ignored. A spinal hernia, on the other hand, is uncomfortable but not dangerous. The problem is that the symptoms can look similar. People often do an MRI, see the words thoracic disc herniation, and think they found the cause. But in 90% of cases, that small hernia has nothing to do with their chest pain. Anatomy of the thoracic spine. The thoracic spine, the part behind your ribs, is the most stable section of the spine. The vertebrae are small and the discs are thin. That's why large hernias are extremely rare in this area. So even if your MRI shows a small protrusion, don't panic. It usually doesn't cause severe pain, and it definitely doesn't mimic a heart attack. When it's really the heart. Be very careful if your pain appears during physical effort or emotional stress, feels like pressure, heaviness, or burning in the center of the chest, radiates to the left arm, shoulder, jaw, or between the shoulder blades, comes with shortness of breath, weakness, or cold sweat. These are classic signs of coronary artery disease or angina. And if the pain lasts more than 15-20 minutes, it might already be a heart attack. No spinal problem can cause this pattern of symptoms.
When it's the spine, pain from a spinal hernia or intercostal neuralgia feels very different. It's usually sharp, stabbing, or shooting. It may wrap around the chest like a belt, following one or two ribs. It worsens with movement, twisting, bending, deep breathing, coughing, or laughing. It can last for days or weeks, but doesn't depend on exertion. If you can reproduce the pain by changing your posture, it's almost certainly musculoskeletal, not cardiac.
Simple self-test. Try this quick check. 1. Sit up straight and take several deep breaths. If the pain increases, it's likely neuralgia or a muscle spasm. 2. Turn or bend your torso gently. If the pain appears or gets stronger, it's from the spine. 3. But if the pain starts at rest or after exercise or stress and isn't affected by movement, that's your heart, and you need medical help immediately. What to do if you suspect heart pain? Stop and rest. Don't keep walking or climbing. Take a nitroglycerin tablet under your tongue if you have one. If the pain doesn't go away in 10 to 15 minutes, call emergency services. A cardiologist will perform an ECG, echocardiogram, troponin test, and possibly a CT coronary angiogram to check for blocked arteries. Prevention tips. To reduce the risk of both heart and spine problems, maintain good posture and strengthen your back muscles. Do gentle stretching and mobility exercises daily. Manage stress and practice deep breathing. Keep a healthy diet, less sugar, salt, and processed food. Stay active, control your weight, and quit smoking if you smoke. A hidden danger. Sometimes, heart attacks don't cause chest pain at all, especially when the back wall of the heart is affected. The pain may feel like it's in the spine. I've seen patients suffer from back pain for days, thinking it was just osteochondrosis, and then suddenly die from a heart attack. So if you're unsure, always check your heart first. Friends, this video might literally save a life. If it helped you, please like, subscribe to Energy and Health, and share it with your loved ones. Take care of your spine, but most importantly, take care of your heart. See you in the next video.